The Essential Plan. This is Bankmed's entry-level plan, best suited to members with few healthcare needs and limited finances. It's for emergency medical conditions and provides minimal cover. The plan offers a rich variety of wellness benefits, except for contraception. Healthcare benefits are limited to prescribed minimum benefits, also known as PMBs. HIV and oncology cover is limited to prescribed minimum benefits only. There is restricted cover for pathology and radiology, while there is no cover for optometry or dental. Any condition that isn't classified on the prescribed minimum benefits list, such as an elective hip replacement, for example, isn't covered on the Essential Plan. Visit the Bankmed website or app to see exactly which conditions are covered. The Essential Plan doesn't have a savings account or an above threshold benefit. It has restricted networks, except when you have a medical emergency, which include the Bankmed GP Entry Plan Network, Specialist Network, Hospital Network, Pharmacy Network, and contracted state facilities. Your GP will refer you to specialists within the Specialist Network. If you choose to be admitted overnight to a hospital outside the network, there will be a 20% co-payment, which means you'll have to pay in 20%. Pre-authorization, restricted medicine formularies, and scheme protocols apply. If you're already on this plan, you'll be pleased to know that Bankmed has once again increased your current benefits and added new benefits for 2018. At the same time, we've managed to limit your contribution increase to 6% and increase your benefit limits by 5.5%. These are some of the new wellness and preventative benefits for 2018. Non-invasive prenatal testing is now available for high-risk pregnant women who are 35 years or older at delivery. Women who have had a previous pregnancy with trisomy 21, 13, or 18, or where a fetal ultrasound or other screening findings indicate a high risk for Down syndrome. Another new benefit is newborn screening, including the early screening, diagnosis, and management of selected rare inherited diseases, such as phenylketonuria. Glaucoma as a screening test has been removed, and a pneumococcal vaccination is now necessary only once every 5 years, unlike the current provision of once a year. There are also new guidelines for network arrangements. An additional network is Premier Plus, which allows for a disease management program for diabetes mellitus and heart health. The day surgery network now includes a defined list of procedures. For example, an endoscopy, colonoscopy, tonsillectomy, circumcision, or myringotomy. If you voluntarily use a facility that's not in the network, there'll be a 1,500 Rand co-payment you'll need to pay in. Likewise, there is a 20% co-payment if you use a psychiatry facility that's not in the psychiatry network. If you are treated for major depression, bipolar mood disorder, and schizophrenia, you can now have a psychiatric consultation within 30 days of being discharged. And if you need medical and surgical appliances, take a look at the benefits and contribution schedule to see how many you can have and how often. Remember, we value your health as much as you do. Here's to your good health.